Reena completed her nursing studies and started working. She complained of headaches, body aches, and always feeling tired. She quit the job. She had a breakup with boyfriend because of her stress. She remained inside the house always. Parents take her to a physician. After various tests, she was referred to a psychiatrist. She is suffering from anxiety disorder. Experiencing occasional anxiety is a normal part of life. But people with anxiety disorder frequently have intense, excessive, and persistent worry and fear about everyday situations. Let's have a look at the anxiety disorder in detail. The types: generalized anxiety disorder or GAD. It is characterized by chronic anxiety, exaggerated worry and tension, even when there is little or nothing to provoke it. Obsessive compulsive disorder or OCD. It is characterized by recurrent unwanted thoughts, that is obsessions, and repetitive behavior called compulsions. Repetitive behavior, for example, hand washing, counting, checking, or cleaning. They repeat these behaviors. Panic disorder. It is characterized by unexpected and repeated episode of intense fear accompanied by physical symptoms that may include chest pain, heart palpitations, shortness of breath, dizziness, or abdominal distress. Post-traumatic stress disorder, that is PTSD. It can develop after exposure to a terrifying event such as a car crash or abuse. The person feels anxious for months or years after the event. Social phobia or social anxiety disorder. It is characterized by overwhelming anxiety and excessive self-consciousness in everyday social situations. Separation anxiety disorder. This condition mostly happens to children or teens who may worry about being away from their parents. Children with separation anxiety disorder may fear that their parents will be hurt in some way or not come back as promised. Agoraphobia. Fear of two or more of these environments like closed spaces, line, that is queue or crowds, then open spaces, any place outside your house, then public transportation. All these things create anxiety in the person with agoraphobia. Let's have a look at the symptoms. Symptoms vary depending on the type of anxiety disorder the person has. General symptoms of an anxiety disorder are: physical symptoms include cold or sweaty hands, dry mouth, heart palpitations, nausea, numbness or tingling in hands or feet, then muscle tension, shortness of breath. Psychological symptoms include feeling panic, fear and uneasiness, nightmares, repeated thoughts or flashbacks of the traumatic experiences, then uncontrollable and obsessive thoughts. Behavioral symptoms: to be still and calm, ritualistic behaviors such as washing hands repeatedly, then trouble sleeping. The causes: genetic. Anxiety disorder tend to run in families. One may inherit the anxiety disorder from one or both the parents. Neurological. Either autonomic nervous system abnormalities or severe or long-lasting stress can change the chemical balance that control your mood. Environmental causes. Experiencing a trauma might trigger an anxiety disorder, such as abuse or bereavement. Then big life changes, such as moving away or becoming unemployed. Medical causes. Having a chronic illness that poses challenges to daily living, then having a disease that causes very challenging symptoms, for example palpitations, then having a condition where anxiety is a symptom like hormonal imbalance, and sometimes certain drugs can cause anxiety as a side effect. Diagnosis. Physical examination. It is conducted to rule out medical conditions that mimic anxiety symptoms. Many things like certain illnesses, medications, alcohol consumption, hormones, etc. can contribute to anxiety. Psychological assessment. Specially designed interview and assessment tools are used to figure out if the person have an anxiety disorder. Appearance of 3 of the following 6 symptoms should be there. That is restlessness, fatigue, irritability, muscle tension, sleep disturbance and difficulty concentrating. Symptoms significantly interfering with the person's life and should present at least for 6 months is considered to diagnose as anxiety disorder. Management. Anxiety is considered as a disease requiring treatment when it arises in the absence of any threat or in disproportionate relation to a threat and keeps the affected individual from leading a normal life. Anxiety disorders can be treated with psychotherapy, drugs, or both. Cognitive behavioral therapy is a type of psychotherapy of first choice in the treatment of the anxiety disorders. Cognitive behavioral therapy for anxiety teaches you to recognize thought patterns and behavior that lead to troublesome feelings and then work on changing those behaviors. Exposure therapy. It focuses on dealing with the fears behind the anxiety disorder. It helps the person engage with activities or situations that he may have been avoiding. Exercise therapy. Exercise is therapeutically useful in both the short-term and the long-term management. Medication. Anti-anxiety medications such as benzodiazepines may decrease the person's anxiety, panic and worry. Antidepressants change how the person's brain uses certain chemicals to improve mood and reduce stress. Beta blockers, usually used for high blood pressure. It can help reduce some of the physical symptoms of anxiety disorders. They can relieve rapid heartbeat, shaking and trembling. Hope you like this video. Please subscribe the channel for videos on related topics. Thank you and keep smiling.